adoring what she did for others. She made instant connect with people. She made instant connect with people around her, and in their core being only to care for the welfare of those who are suffering and all around her. I have not met Mother Teresa. To me, Joyce Romani was no less. Please give the lady a big. It was my privilege and honor to have known her quite well. It was gratifying to know that those who have followed Dr. Joyce in NPAs.
She was widely linked between the lasting government of the program, the development of medical body, the ability integrity and organization, capabilities are always strong. In many years, this is the document of the problem member of the Congress working committee in charge of Tamil Nadu, Jubilee.
ಈಗ ಅವರ ಕೆಲಸ ತಂದು ಮುಖ್ಯ ಅತಿಥಿಗಳಾದಂಥ ಸನ್ಮಾನ್ಯ ಶ್ರೀ ದಿನೇಶ್ ಗುಂಡು ಅವರ ಪರಿಚಯವನ್ನು ನಮ್ಮೆಲ್ಲರಿಗೂ ತಿಳಿಸಿಕೊಡಬೇಕಾಗಿ ವಿನಂತಿ.
I will yield to our chief guest request to take it away. Shri Dinesh Gundu very, very close to mental health. He was born on the 9th of October, 10th of October, the world day. In Southern
Board members have taken this part in the most compassionate manner. We wish them all the very best. I am sure you will carry on this noble work for years to come. I end this by saying that I salute all my colleagues, all my teachers, all those people. My teachers have been my patients and their families and their caregivers. They cannot be better than those from whom I have learned and I continue to learn every single day I serve.
Dinesh, the noble boy of Medico Boys School and the famous BMS College of Engineering in Bangalore, he completed his engineering degree in electronics and communication with a first class. He made his foray into politics in 1993, emerging within a short time as a people's leader thanks to his dynamic and service-minded personality. His association with the State Youth Congress saw him rise from General Secretary in 1994.
To support NGOs wherever it is necessary, sir. Like MPA, all NGOs are short of money. We look forward to governmental support, without which we cannot function. We work on shoestring budget and we require governmental support, both financial and other government resources. I am sure, Mr. Gundu, you will come forward to help those who are in need, because every individual you help, their welfare and their quality of life improves, and you will be very thankful. Mental health is too big an issue, a task that can be taken care of with professionals alone. We need the support of families, the clients themselves, and the community at large to support, without which mental health cannot be taken for multiple professions. A huge congratulations to on your golden jubilee, and may you go on to score a century and beyond. God bless you all. Thank you.
Mental health care. The president of the association, Dr. Joseph George, and the vice president, Dr. Jubilee, all the mental health professionals who have been felicitated today, and all the other members of the Medical Pastoral Association, and dear friends, ladies and gentlemen. So I want to thank all of you for having called me on this wonderful occasion and making myself aware of this wonderful organization, which I was not aware of till now. So, as soon as I came, your president took me around the place and showed me how the association is working and the facilities in this association. And the effort and determination that I've had in running this place for the last 50 years, I think it is a fantastic job they've done, and round of applause to the association, because this subject of mental health is department, and try and give more awareness, try and give spread the information, spread the knowledge across the state. There are so many people who have got various phobias about this, various wrong perceptions about this, and the way they treat those people also is something which is which is also very disheartening and quite sad sometimes, because people who have mental health issues can definitely be treated and can definitely be able to live normal lives or close to normal lives if proper care is given. And the brain health initiative that Government of Karnataka has started this year, in our budget we announced that we will be taking it across the state, so that we link up the people who are from the smaller towns and smaller from the villages also, to be able to access professional good mental health experts and professionals. So that link has to be established, and that is the main focus of this brain health initiative, where we try to link up the mass with the people who really understand the subject. And that, I think, is a key area which with NIMANS that has been tied up, and we will be taking it forward this year in a much bigger manner, to see that we can give better care to the people and more awareness and availability of so much ways of treating it, drugs or therapy. So many ways are there to treat it. So we want to take that to the people in big numbers. So I think that is one of the key areas that we will be looking. I think Karnataka in the country, I think, is giving more focus on mental health than any other state. So in that aspect, we are ahead of it. ಅವ್ರಿಗೆ ಅನುಭವ ಇದೆ. ಸೊ ಎಲ್ಲ ಚೆನ್ನಾಗಿದೆ ಅಂತ ಹೇಳೋಕ್ಕಾಗೋದಿಲ್ಲ, ಆದರೆ ಇನ್ನೂ ಮಾಡಬೇಕಾಗಿದೆ ಭಾಳ ಇದೆ. ಖಂಡಿತವಾಗಿಯೂ ಅದನ್ನು ಮಾಡೋದಕ್ಕೆ ಪ್ರಾಮಾಣಿಕವಾದಂಥ ಪ್ರಯತ್ನ ಮಾಡಿ. Definitely, my office will be open to all of you. Anyone who needs anything to be done with the government or any coordination with us or any support from our side, we will definitely do our best to the maximum extent possible. And our doors will be open to all of you. And because all of you are, got such glittering careers and we've done so much of good work and been able to contribute so much to society. I mean, we see so many other doctors and people who are in other similar lines in medicine, but they tend to get more name and more fame. But the people like you, who I think would have contributed equally or more, the attention is less. But still you have determined, you have gone ahead and done your work without looking for all that and still doing because you believe in it. So you have passion for it. I think that is something which is really appreciable. And I commend all of you for having rendered this great service and inspiring others to follow in your footsteps. And so that the next generation will have better outcomes and they have a path to follow looking at all of you. So I'm sure in the future we will try to see that things go to a better to a better level, a more improved level, and we are with you. So I want to thank again the MPA, the Medico Pastoral Association, and I'm sure that in the days to come your association will do more work, and the way you're treating these people and taking care of them, I think it's a fantastic job. And I think the spirit of sacrificing more than more than the economics of it. There's so much of sacrifice, there's so much of purity in this world, which I think is really inspiring. So I want to congratulate and thank you, and I want to thank all of you. And I'm very glad that I got the opportunity to come over here. And anything in the future, please do contact me. I'm always there. Thank you very much.
My name is Joseph George. I am the president of Medico Pastoral Association for the last 3 years, and we have an officers list, and we manage this. Basically, a mental health institute home for people with mental illness, and they can come here. We provide them residence, we provide them medical care, we provide psychiatric care, and they have a counseling team, and whenever there is emergency they are taken to other hospitals for help. So basically we started 50 years ago, for the people who had no home. Mentally ill were all, even their own home did not accept them, because they were mentally ill, were considered as difficult people to manage. And so the whole 50 years ago, mental illness was considered as something very fearful, scary. You should not talk to them. Even family members were scared because of the different symptoms. But then there was a doctor here from the St. Mark's Cathedral, Dr. Joy Shiromani, who started this for one woman first. Then it became more people, and then later they found more residents to come. Now we have 42 residents in place. Then we have 8 days people. They morning they come, evening they go, after attending the activities. So basically this is meant to help people with serious mental disorders, and they have a different kind of program than the normal kind of our activities. So it's all focused towards helping them to adjust to the medications, and so there is provision for medication, there is provision for psychiatric help, there is provision for daily counselors sitting with them and talking to them, managing them, and also looking at how they can be not only symptom relief, but how they can be functional, how they can become more functional, start working. Now we have about 8 people in the Navajivan hostel. After 2 years of recovery, treatment and recovery, going to work outside. They go for half-day work outside and then come back in the evening after finishing their task. So it is always important to look at, rehabilitating them with and helping them to say there is purpose in my life. Because many times mental illness, they say I cannot manage, family they say I cannot manage, that always that kind of a situation. So
today Minister had come and has given us insurance for you regarding this mentally health people.
Yeah.
What would you like to say?
No, Minister of Health, Family Welfare, Dinesh Gundu, he has good with us. he has been giving a lot of positive kind of statements about his department, looking at health in particular and mental health in especially. So, and his speech, he has said that, whatever initiative, new initiative you start, his office is open and we can go anytime. So we are very happy that that kind of an assurance we got from the minister. So certainly that shows we have a minister who is open to the community, the public needs, requirements, and this is a special population which others do not give enough attention, and so certainly this is something we are looking at how we can help.
Okay, sir. Thank you.
Okay, we also have a long-term support project,
Okay.
and that we are going to start in the near future. It is about one-story building behind this that is called Long Support Care Project, and we need some money for that because so the Long Support Care Project is supposed to help 60 residents to say people with mental illness, 60 of them, and the support staff to stay in the same place, and that space is behind this building, and so there is that plan for the long support.
You have to give a memorandum to the area MLA regarding this.
No, we have not given a memorandum as such. We have informed him that we have a function, and then his office already informed that today he is not available, otherwise he would have been coming to see part of the program. So we are going to him in the near future with our long support project building. So certainly we have assurance that our MLA will help us in this. Yes, certainly. Yes.
Thank you.